Hello, I'm here with Tim Evans, the Senior Director of Nutrition and Population at the World Bank. Thank you so much for joining me.
Thank you for having me on.
Can you talk to me about a resilient and responsive health system? What does that mean for you?
What it really means to me is that it is a system that can deal with both the challenges that come up in times of certainty as well as uncertainty. And so resilience is really the ability to manage that host of challenges that every health system faces, not only the predictable, but the unpredictable. And we really have to anticipate that there will be both. And so resilience means preparing for both what we know is a challenge and what we don't know, but we know we have to be prepared for.
Specifically, when we look at Health Systems Global and the World Bank, as well as the other members and partners of HSG, what do you think that you can do to improve resilience and responsiveness in health systems?
The bank's primary entry point to working with countries is through financing. And so the question is then what to finance and how to finance. And if we think about what to finance, and the challenge of resilience, we need to think about not only the immediate clinical services that respond to people's daily needs. We also have to be investing in those capacities that allow systems to move from time to time in extraordinary ways to respond to outbreaks of infectious disease, cholera or Ebola. So we have to keep our eye on making sure that those capacities of health systems are kept alive even though they're not used every day. So that's one thing that the World Bank, I think, is trying to pay a little bit more attention to. Sometimes we discount or we have a blind spot with respect to those core public health functions which we don't use every day. But we've learned, especially following the Ebola crisis a couple of years ago, that every country has to have vital capacity in those areas.
It's probably tougher to make the argument for that kind of funding because you don't see it used right away, right?
It's right. You're absolutely right. But we've had that challenge in other areas of public health. For example, a childhood vaccination. No one sees the real benefit of that because children don't get sick. And so in the absence of children not getting sick, people think, well, there's nothing that's really happened. And so we need to draw on well-tested investment approaches to primary prevention and readiness, which we have a reasonable track record.
What role do you think that health policy and health systems research has to play in building these resilient and responsive systems?
It's really central, and I'm not only saying that because we're at this meeting, but in part because the knowledge and know-how to build systems that are resilient and responsive is sorely lacking everywhere. We tend to be very focused on the short term and the immediate. It's very difficult to plan into the medium and longer term, and those are the sorts of institutional capacities sometimes that we need to build, laboratory capacities that involve the agricultural sector in addition to the health sector. Those are things that won't save anybody's lives necessarily tomorrow, but they will if you allow them the time needed to get to a point where they're fully functional. So we have to have the patience to do that, but understanding then what the best use of resources are and how you know those systems are actually working requires a lot of know-how and testing. Things like simulations, tabletop exercises. Those are really applied exercises that are very, very important in the context of emergencies and crises. There's a tremendous amount of knowledge and know-how that we could generate related to how to do those better, how to make sure we're exercising systems sufficiently so that they are in shape to respond when there is a crisis. So this agenda is, again, relatively neglected with respect to the bigger agenda of health policy and systems research, but a very important part of it.
Well, thank you so much for your time.
Thank you.